Most men and women at certain stage in life suffer from hair loss. It's inevitable. And one of the first things someone notices about you is your hair. So it's a major impediment, to your self-esteem. Many people, everyone wants more hair. Currently, there are different techniques people are using for hair restoration. I'm going to briefly talk about them individually. The oldest one, the gold standard, is hair transplant. Great technique, but the drawback of this technique is basically redistribution of existing hair. So in an area where there is abundance of hair, or relative abundance, doctors take hair follicles out and they implant it in the area which is missing hair. So this is one of the things people use. However, the drawback of this is it's a surgical procedure, invasive, and also it's basically redistribution. So the number of hair on patient's scalp is not going to increase. It's going to look a little fuller in the area where there was less hair. So you have to come up with something better than that. We do have a few techniques that I'll talk about. The first and most general one is PRP, very common, practiced all over. Basically, PRP is platelet-rich plasma. So blood is taken from a patient, then there's a centrifugation step. So the clear part of the blood, which is referred to as plasma, it is taken. Then you spin it again at a higher speed, and the platelets, they come at the bottom. So those platelets are taken out, and then they are basically injected into scalp where there is little hair or hair density is little low. So platelets are great. So they release chemical called PDGF, platelet-derived growth factor. So platelet-derived growth factor transitionally, locally activates stem cells. And these stem cells then help the hair follicle stem cells to do their job better. So meaning you'll have more hair. So the impediment is that the effect doesn't last very long. So you have to repeat the treatment after every, couple of months or so at least, or preferably after a few weeks. So this is one technique people use. The other technique is, which has gained a lot of momentum and it's all over the social media, is exosomes. And people are selling exosomes as stem cells. A, exosomes are not cells, stem cells aside. B, their effect is also relatively limited. So exosomes are basically, cell secretions. An average human has trillions of exosomes. A drop of blood has about 1 billion exosomes, one single drop. So just adding more exosomes to a person is not going to be too terribly effective unless those exosomes are special. By special exosomes, I mean exosomes that are coming from, say, umbilical cord or mesenchymal stem cells driven from umbilical cord. Mesenchymal stem cells won't produce as potent exosomes as the other category I talked about. So they're great. Again, it's transitional. So you have to keep on getting exosomes periodically, like every couple of weeks or every couple of months. And they are very expensive, the good ones. Okay. So, and they cost about the same as SVF. Now, let me describe what is SVF. SVF is stromal vascular fraction. So what we do is we take the fat from a patient, we process it chemically and physically. There are centrifugation steps and there are enzymes involved, and we isolate stem cells from patient's own fat. And it's not a pure population of stem cells, but it has other important therapeutically beneficial cells, which are then, when injected in the scalp, also help invigorate hair follicle stem cells. So response is again great. The advantage here is that you have added cells actually, and these mesenchymal stem cells will produce exosomes, and they'll keep on producing for a significantly longer time. So if you get this SCF treatment done for hair loss, the effect is going to be far more robust, resulting in much thicker, fuller scalp, and also it will last much longer time, say a couple of years, depending upon patient to patient. So the other category of stem cells is umbilical cord stem cells. Generally, people don't use that for cosmetic purposes, but since we are talking about it, I'll describe them. So umbilical cords are taken from newborn babies after thorough screening, ruling out any infectious material or any pathogens in it. The advantage is that you can get millions of stem cells. So there's a greater number of stem cells that you can put in the scalp. And again, these cells have a relatively longer life. They'll keep on producing exosomes and help you get a fuller scalp. So these are basically different techniques. The other question is how about MS? Whether someone should get SVF treatment or exosomes? It all depends. You see, exosomes are again transient, and if you're paying just as much as it would cost you to get SVF, my vote would be SVF. Get SVF, not the exosomes. But again, it's a lot depends upon personal preferences and what patient want, what the expectations are. So I hope that helps. Thanks.